Hello friends, I'm Dr. Shuchita Batra. I'm a consultant gynecologist at Ludhiana Gastro Gynae Center. आज अपनी वीडियो में हम लोग डिस्कस करेंगे कि किस तरीके से HSG किया जाता है, किस तरीके से आप अपने आप को प्रिपेयर कर सकते हैं बेस्ट HSG फाइंडिंग्स के लिए. So just to recapitulate, क्या होता है HSG? It's an X-ray based procedure, so it's very important that you tell your doctor about your last menstrual period in case if there is a suspicion of pregnancy. In case if you are having any kind of discharge, do inform your doctor. They are going to give you proper antibiotics, antifungals, and only after the improvement in those things can you go for the HSG. In case if you have any sort of a pain, take your gynec into confidence. Ask them if they have got facility for the anesthesia prior to the HSG. In case if you have any other issues regarding the allergy to any of the medicines or painkillers, do inform your gynec beforehand because इसमें आपको antibiotics भी दिया जाएगा, painkillers भी दिया जाएगा. And in case if you have got any sort of medical problem like diabetes, hypertension, allergies, thyroid disorders, do tell your gynec beforehand. Now jumping off to the steps. सबसे पहले the assistant is going to ask you to go and pass urine. Urine pass करने के बाद you will have to lie on the table that is designed for taking the X-ray. जिस तरीके से आपके गायनेक आपका pelvic examination करते हैं, you have to lie supine, followed by you have to bring your bottom to the edge of the table. Then the gynecologist is going to ask you to keep your legs wide apart. Obviously, the perineum is going to be exposed at that moment. The gynec is going to now paint your pelvic area with the help of Savlon or Betadine. That is just in order to remove any kind of infection if at all there is present, and a general precautionary step. After the painting and the draping is done, we are going to introduce the speculum inside the vagina, which is going to open up the vagina. Now the cervix is going to be the visible. After holding the cervix, either the cannula, which is a metallic cannula, that is introduced inside the cervix. एक cannula होता है metallic, आगे से taper होता है, and there are the circles, and it is going to catch hold of the cervix. It is going to fit inside the cervix. Another option is using pediatric catheter. पतला सा कैथेटर होता है, it is made up of a rubber. It is introduced inside the cervix. इसके बाद क्या होता है, उसका बल्ब को इन्फ्लेट किया जाता है ताकि वो बाहर ना आ जाए. सेम थिंग विद द कैनुला, उसको स्क्रूइंग मोशन से सर्विक्स में फिक्स कर दिया जाता है ताकि वो भी बाहर ना आए. Once this step is done, 30% of your work is already done. Now the speculum is going to be removed, and your technician and gynecologist, they are going to ask you to shift upwards towards the table. जब आप upwards shift होते हैं, make sure you do not make any kind of drastic moves, otherwise आपका catheter या फिर आपका metallic cannula वो dislodge हो सकता है और यही सारा procedure दोबारा से repeat करने की जरूरत पड़ सकती है. So once you are supine and आप अपनी टेबल पे ऊपर की तरफ आ जाते हैं, then the radiology technician is going to come और वो अपनी जो एक्सरे की मशीन होता है उसको आपके pelvis के ऊपर पोजीशन करके जाते हैं, and then they put a plate, radioactive radiological plate beneath the table to take the films and the scans. Now everybody is going to leave the radiology room and they are going to go behind the bars, and then the gynec technician or the gynecologist, they are going to push a dye through the cannula or through the catheter. Then they are going to ask the technicians to take an image of the same. First image, second image, third image. Usually 3 images ली जाती हैं and they are simultaneously checked on the computers to see the adequacy. In case अगर inadequate images आती हैं, so you might have to go for more than 3 images. अगर आपके दोनों tubes open हैं, then usually the uterus cavity is going to be okay, tubes are going to be okay, there is going to be a free spill. Definitely जिस time पे dye introduce करी जा रही है, you might feel a little bit of cramping, a little bit of pain, but do take a good amount of relaxed breaths and just keep on talking to your gynec at the same time in case if you are having any problem. In case कोई एक ट्यूब ब्लॉक होती है या दोनों ही ट्यूब्स ब्लॉक होती हैं, then during the X-ray imaging the tubes are not going to be properly visible, या हो सकता है वो एक certain distance के बाद दिखना ही बंद हो जाए. In that case, the gynec is going to try the second time to push the dye a little bit harder so that अगर कोई flimsy adhesions वगैरह present होंगे, they are going to those small blocks, they are going to get washed away. In that time period, you might have a little bit of pain, but do keep faith, right? Then after the 3 images are taken, they are discussed with the gynec and the radiologist, and they are going to be handed over to you in about an hour. You can also ask for injectable painkiller or sedation, जैसे कि मैंने आपको पहले बताया था. Now, what are the things जो आपको आफ्टर द HSG एक्सपीरियंस हो सकती है. You might have some sort of a pain, you can have some cramping, both of which are completely normal. Do take an antispasmodic even after doing the procedure. You can have a little bit of infection, so it is important कि beforehand ही आप अपना infection को ध्यान रखें. एंड बाद में भी अगर आपको किसी तरीके का कोई फीवर होता है या चिल्स होता है, डिस्चार्ज होता है, पुरुलेंट डिस्चार्ज होता है या फिर शिवरिंग होती है, then you do inform your doctor regarding the same. Then you can have a little bit of nausea and vomiting, which are completely normal. So do take any kind of NSAID or ondansetron medicine for the same. Do be light on yourself. Same day, it would be always better to take less amount of food, light kind of a food, and not to take any kind of heavy meals on the same day. And if it is possible for you, it is always better to take a leave or take rest for the same day. In case if you are completely okay, अगर आपने किसी तरीके का sedation नहीं लिया है, आपने सिर्फ oral painkiller पे, oral antispasmodic पे HSG करवाया, then you are good to go. But while driving back to home, it is always better to have a companion. You can also ask your gynec or your radiologist to, keep you under an observation for about half an hour or 1 hour, so that अगर आपको कोई dizziness वगैरह है, that can be always taken care of. Now, once you go back home, you have to look for the following signs of infection. कब आपको डॉक्टर को बताना है कि कोई प्रॉब्लम हो गई है. In case if you have a fever, कोई डिस्चार्ज होता है, शिवरिंग होती है या कोई पुरुलेंट डिस्चार्ज होता है, intractable nausea and vomiting होता है या any other thing which you might think is worrisome, you have to talk to your doctor regarding it. And in case if you have allergy to any of the medicines or drugs or dyes, do inform your doctor beforehand for the best results and least complications. So I hope with this video I was able to tell you how to prepare for HSG and what are the steps that are done during the HSG and what are the things you have to keep in mind after the HSG and when to call the doctor after HSG. So in case if you have any more questions, please do feel free to write to us in the comment box. We'll be happy to help. And do not forget to like and subscribe the channel. Thank you.